Before we begin, please take a moment to review the disclaimer in the episode description. Remember, this podcast is for informational purposes only and is not a substitute for medical advice. Now let's get started. Welcome to Wound Basics, the podcast that does exactly what it says on the tin, helps people to understand the basics of wound care. I'm Dr. Frances Henshaw. This week, I'm joined by Tal Ellis, who is here to talk about incontinence-associated dermatitis, a condition which is relatively common, especially in the elderly. So Tal, let's start by defining incontinence-associated dermatitis. What is it and why is it a concern?
So the most important thing to remember is that incontinence-associated dermatitis is like a red rash that develops on the skin in areas that typically get wet from urine or feces. So the easiest way to think about it is like an itchy sort of red rash that typically appears the same on both sides of a person's, either in the bottom or between their legs, and can often have a red sort of mottled kind of appearance, or sometimes it's sort of pink and also dark red little prickles. But on somebody, on a person, for example, that has darker skin, it can actually appear as an area of darker skin. So it can be any number of those types of things. The important thing is that it only occurs where urine or feces, in particular urine, is getting directly onto the skin and staying in contact with the skin for a prolonged period of time.
Well, that's a good way of identifying it to start with, is by location and the fact that it has to be associated with incontinence, I suppose.
Yeah, I think that, often we see rashes appearing on people in different places, particularly in the older person. No matter what their skin colour, you can see changes in the skin over time. It might occur on the lower legs, if they're prone to having, vein problems or something. Sometimes their skin becomes quite discoloured or reddened. It might be on the head or face, or etc., which is, where you get like typical eczema or dermatitis or, psoriasis type spots. Those things are not incontinence-associated dermatitis. This is very specifically about those areas that typically come into contact with urine and faeces.
So
Remembering also, though, that in some patients or some people that you're looking after, we will see it, for example, if they've got a stoma, or so that's where the piece of the bowel has been brought out onto the tummy so that they can pass feces that way, or sometimes they have one for urine. Those types of areas can also get incontinence-associated dermatitis because they're in contact with urine and or feces.
Good point, Tal. And why is this such a concern? I mean, obviously any breaks in the skin or redness is a concern, but what can happen if it goes untreated?
So what tends to happen is that you can end up with infections. Now, most typically, the first type of infection that you'll get, so whenever the skin's broken, it makes the person more vulnerable to infections. In other words, bacteria can get into the skin, they can get down into areas of the skin that they ordinarily wouldn't exist in, and they can cause all sorts of mischief. And then that can lead to even illness within the person if it gets bad enough. But usually what we see before that is a fungal infection. So sometimes we get these fungal spores that live in and around all over our body, all in the environment, etc. They typically will get onto the skin because the skin has changed and is more broken open, if you like, or is reddened, inflamed. Those fungal spores are able to get in, set up a colony, and off they go, and they can cause all sorts of mischief in themselves. And then one thing leads to another. You end up with both a fungal and also a bacterial infection, which can then lead to illness in the person.
Once you're dealing with fungus and bacteria in a wound, you can really struggle to get it healed. So I guess the message there is to, when you see this, get upon it straight away. So I think we've kind of established that the key risk factors that healthcare workers should be aware of when looking for incontinence-associated dermatitis are the fact that the person is incontinent, and then looking for this rash that's kind of symmetrical on both sides of the body in the areas that are connected with feces and urine. But obviously there is still other skin conditions that could perhaps mimic IAD. So how can healthcare workers differentiate between IAD and other skin conditions?
So this is actually a really, really important point. Even though IAD we would typically associate with being in areas that are in contact with urine and faeces, it can be a little bit confusing sometimes. Let's face it, for people that sit in a same position for a long period of time, when they stand up or move or roll over or whatever, you can often see a red spot, or in a person with darker skin, a darker appearance in the skin. And that can sometimes mimic what IAD would look like. The important thing here is to make sure that you look at the shape and where this has actually occurred. So as a consequence, what we often see is IAD will look like a butterfly shape, so it'll have butterfly wings, and it will be very evenly distributed on both sides of the buttocks or on both sides of the legs, whereas a pressure injury typically will occur just over the spot that's been pressed against the bed or pressed against a chair or whatever else, what other surface the skin's been in contact with. So I think that's a really important defining issue. The other thing to think about is when it's occurring. So if you're finding that this redness only occurs when the person's got a wet continence pad, for example, then that is more likely to be IAD, as opposed to this redness is there with or without that, and even when the skin's been kept dry.
This episode of Wound Basics is brought to you by Smith & Nephew, shaping what's possible in wound care.
So obviously there's a lot of strategies to manage IAD. And what common challenges do healthcare workers face when they're trying to manage IAD, and how can these be effectively addressed?
So let's talk about the challenges first. I think the reality is that many elderly people who we look after in residential aged care, or even in community for that matter, suffer from incontinence. It's one of those things that as the pelvic floor muscles become weaker as we get older, we tend to have some degree of incontinence. So it's an incredibly common problem, and therefore that's the biggest challenge, is that it occurs incredibly frequently, and therefore you're having to deal with it. The second thing is that an older person's skin has lost a lot of the natural protective functions that skin normally has. Particularly, it's lost part of its fat layer, or the lipid layer we call that, but just imagine it's like a special kind of fatty kind of substance that sits between all of those cells. As you get older, you start to lose that, which means moisture, and particularly things like urine, can actually penetrate deeper into the skin and create more problems. So not only is it common, it's common in older people, and older people's skin is not as protective as it used to be. The third part of it is, of course, that an older person has a ramped down immune system. So in other words, that they are not able to fight off bacteria and fungal problems as much. So we tend to see the secondary problems related to IAD more often. If you look at the statistics, up to a quarter of people in residential aged care can actually have IAD at any one time. So it's a really big problem. Okay, so that sort of sets the scene a little bit. Keeping the skin, clear, washed, and also moisturised is extremely important as a protection against IAD. And being able to do that all the time to large numbers of people can be a challenge. Getting access to the right sort of products, the right sorts of emollients, etc., is extremely important. And so, if people are wondering, what is it that I can do to help this person, making sure that they're adequately and properly moisturised in the areas that are vulnerable is extremely important. And I think the other thing too is making sure that the incontinence aids that are being provided for that person, so anything that's going to assist with soaking up urine or catching faeces, etc., and keeping it away from the skin is extremely important. So frequency of change is something that you need to be thinking about. You can't just leave wet pads, wet incontinence aids against the skin for any length of time. They need to be changed as soon as the incontinence occurs, and that needs to be done in a vigilant way.
Right. So I think you've given us some great pointers there, Tal. Thanks very much. And, it seems like the mainstay is good skin care and good management of the incontinence. And of course, when we have problems like this that do affect vast numbers of people. And you mentioned that a quarter of people in aged care at any one time can have IAD. Usually this causes experts in the field to come together and make guidelines or protocols. So can you tell us about any specific guidelines or protocol that perhaps are available for healthcare workers to follow so that they can understand more about this important condition of IAD?
So that's a really good point. The Continence Association of Australia has guidelines which have been developed by international groups and are easily available via the web, and so anyone can access them. And I think that the Continence Association is actually an important resource to direct even the relatives of people who are suffering IAD toward as well, because they can find a whole host of information there that is going to help them to understand, what their relative might be going through. But as a healthcare worker, these guides and these pamphlets, etc., that you can get through that are very, very easy to read, easily accessible, as easy as getting it up on your phone at any time of the day or night. And I would suggest that that's where we go to get that kind of thing.
No, that's great intel. Thanks very much. And I think it is really important for people who have incontinence and their relatives and carers to be able to access these resources, because I can imagine that often they probably feel like they might be the only person in the world that's suffering from this, and they may be ashamed or suffering in silence. So it's good that there are associations like this that can really, point people in the right direction and give them the level of comfort that they might need to know that they're not the only person that's got this condition. So before we conclude, Tal, do you have any final thoughts or advice for people who are dealing with incontinence-associated dermatitis as part of their daily work?
So I have a few thoughts. I just wanted to add one little part to what I was saying before. Also, your local pharmacies are a really good source of information. If you walk into the pharmacies, there's plenty of pamphlets and stuff on IAD or incontinence generally, and that can actually link you up with associations and whatever. So I thought I'd just throw that one in. If you are dealing with somebody who has incontinence-associated dermatitis or is at risk of incontinence-associated dermatitis, it's important that you help the person who is suffering from that to understand what to look for. So if they're self-caring, it's really important that they're understanding what it is that they're looking for, and that they understand the importance of using a really good quality moisturiser or skin protectant. It's extremely important that they do that. It's extremely important that whenever possible, you are changing the incontinence aids as frequently as possible so that we lessen the risk of the incontinence-associated dermatitis. And above all, it's really important to give that person emotional support, because this sort of change can be highly confronting, and it not only speaks to the changes that happens in a person's body as they're getting older, which is confronting enough, but it also speaks to an area of life that we don't typically like to talk about. So I think the emotional component is extremely important. So the hallmarks are really good advice, really good emotional support, and really, really good skincare.
Tal, that's excellent advice. And thank you for giving us a little bit of a walkthrough of this quite emotive topic, I think, which obviously is more widespread than perhaps we realise, because in our everyday lives, we probably don't talk about incontinence very much. So it's been really good to have you on the show to discuss this topic. Tal, thanks very much for joining us.
Thanks for having me, Francis.
Thanks for listening to Wound Basics. This show was brought to you by Smith & Nephew, shaping what's possible in wound care.